G'day parents. As a doctor and a fellow parent, I've seen my fair share of skin issues. Skin infections are incredibly common in children. Don't worry though. Most are harmless and easily treatable. This guide will give you the lowdown on skin infections in kids. We'll cover the most common types, symptoms to watch for, and when to seek medical help. Stay tuned for some handy tips and insights in the following sections. Knowledge is power. And in this case, it's the power to keep those precious little smiles beaming. So let's get started and ensure our kids stay healthy and happy. Skin infections can be caused by different types of germs. Bacterial skin infections are the most common. Think of things like impetigo. Viral infections can also cause skin problems. Chickenpox is a classic example. Fungal infections thrive in warm, moist environments. Ringworm causes a ring-shaped rash. Finally, let's not forget about parasitic infections. Scabies causes intense itching. Eczema, though not an infection, can be triggered by germs. Good hygiene is key to preventing skin infections. Treat cuts and scrapes promptly to avoid infections. Keeping your child's skin healthy helps them stay active and happy. Now that we know the different types of skin infections, let's uncover what causes them. Understanding the culprits can help us prevent these pesky problems from popping up in the first place. One of the most common causes is poor hygiene. Not washing hands frequently or properly can spread germs like wildfire. Kids love to touch everything, from toys to pets to their faces. Teaching them good hand hygiene is crucial. Contact with infected individuals is another major culprit. Kids are social butterflies, and close contact during play, school, or daycare can easily spread germs. It's important to teach kids not to share personal items like towels, hairbrushes, or hats, as these can harbor germs. A weakened immune system can make children more susceptible to infections. Conditions like eczema, which compromises the skin's barrier, can also increase the risk. Keeping your child's immune system strong through a healthy diet, plenty of sleep, and regular exercise is essential. Lastly, environmental factors can play a role. Warm, humid weather creates the perfect breeding ground for bacteria and fungi. Cuts, scrapes, and insect bites can also provide an entry point for germs. By understanding these common causes, we can take proactive steps to protect our children from skin infections. Section 4. Recognizing the signs. Is it a skin infection? Skin infections are like uninvited guests. You know something's not right when they show up, but how can you be sure it's a skin infection and not just a harmless rash? Let's learn to recognize the telltale signs. The most common symptom is redness. The affected area might look inflamed and feel warm to the touch. Itching is another classic sign. Your child might be constantly scratching or rubbing the area, which can worsen the infection. Swelling is another indicator that something's amiss. The skin might look puffy or raised, and it could be painful to the touch. If you notice any of these signs, it's essential to pay attention and take appropriate action. Remember, early detection is key to preventing complications. Section 5. Beyond the surface, associated symptoms. Sometimes skin infections come with additional symptoms that go beyond the surface. These associated symptoms can provide valuable clues about the severity of the infection and whether it's spreading. Fever is a common sign that the body is fighting off an infection. If your child develops a fever along with a skin rash, it's essential to seek medical attention. Fatigue and a general feeling of malaise can also accompany skin infections, especially if the infection is more widespread. Swollen lymph nodes, those small bean-shaped glands located in the neck, armpits, and groin, can indicate that the body is trying to fight off an infection. If you notice any swollen lymph nodes near the area of the skin infection, it's important to let your doctor know. In some cases, skin infections can lead to more serious complications such as sepsis, a life-threatening condition that occurs when the infection spreads to the bloodstream. While rare, it's crucial to be aware of the signs and seek immediate medical attention if you suspect sepsis. Always trust your instincts. If you're concerned about your child's symptoms, don't hesitate to reach out to your healthcare provider for guidance.